Ladies and gentlemen, may we have your attention, please? Please make yourself comfortable because we'll start our main session now. Ladies and gentlemen, this is the very moment that we have. This plenary session will be divided into two speakers in each session. There will be two speakers. There are Dr. Armazi Kamaludi Sharif and Associate Professor Dr. Eng Yi-hyung. Then this first plenary session will be moderated by Dr. Amelia Fitra. Dr. Amelia completed her master's degree in medical education from Universitas Gadjah Mada and completed her undergraduate studies in medicine at Universitas Brawijaya. In her recent research, she has focused on highly relevant and impactful topics, including the clinical characteristic of COVID-19 patients, the risk factors for stunting, and maternal health. She also has several key areas of research, as well as medical doctor and pathology. Please welcome with big applause our moderator, Dr. Amelia Fitra Hasanah, MHPE.
Salam kebajikan. Firstly, let me introduce myself. My name is Amelia Fitra Hasanah, and I am a lecturer from the medical program, Faculty of Medicine, Universitas Negeri Semarang. And it's such an honor for me to stand here to be the moderator for the first plenary session and for the very first International Conference of Health Science Practice and Education, Faculty of Medicine, Universitas Negeri Semarang 2024. So for this conference, the topic will be about the health system resilience through digital transformation to improve quality of health services. Well, as we've already known that nowadays, the health science along with the healthcare services and also health education has been improving significantly. So every day in the daily practice, we've facing so much challenges, and it made us growing stronger, and we have so much insights to discuss about. And for the example, the global health issues and also how to use the technology to our daily healthcare services. And therefore, we have invited two speakers for this session that will share their experiences and also the knowledge about the topic we will discuss. To Dr. Armaji Kamaludi Sharif, MKM, please give big applause to our first speaker. Good morning, Doctor. Please have your seat. We are very welcoming you here in Semarang. I would like to welcoming you warmly, and I hope that you can stay. And for the second speaker, we have the speaker from Singapore, who is joining virtually from Associate Professor Eng Yi-hyung. Can you hear my voice clearly? Good afternoon to Associate Professor Eng Yi-hyung. Can you hear me? Can you hear me clearly?
Yes, I can. Sorry, I was muted.
Me clearly?
Yes, I can. Sorry, I was muted. They didn't give, but thank you for the invitation.
Okay, thank you, sir. I guess that it's already afternoon there in Singapore, right?
Almost 11:15.
Okay. Thank you for our two speakers here for attending our conference and also sparing their time to share and also give some insights and also share their experiences regarding the following topic we will discuss about today. And Ladies and gentlemen, as what the Master of Ceremony mentioned previously, there will be two presentations from the two speakers today. Each of speaker will be given 25 minutes of presentation, will be followed by question and answer session. So here, if you have any question, you can directly in the discussion session. And also for the online audiences, you can write your question down in the chat box. And if you are in the offline audiences here, you can keep your question for a while and you can ask directly to the speakers. Okay, ladies and gentlemen, for the first one, we will have the presentation for the first speaker. We are having Dr. Armaji Kamaldi Sharif, MKM here. He is currently the Deputy Director for Health Information System Policy Center for Global Health and Health Technology Policy, Health Policy Agency, Ministry of Health of Republic Indonesia. He graduated from Faculty of Public Health, University of Indonesia in 2019, and graduated as a doctor from Faculty of Medicine, University of Yogyakarta in 2008. The area of interest is into the epidemiology, health informatics management, and health administration and policy with several publications he had. And today he will share his insight about policy on digital health transformation for quality health services. So please give big applause for Dr. Armaji. And we will start the presentation. Dr. Armaji, time is yours.
Honorable Rector of Universitas Negeri Semarang, Honorable Dean of Faculty of Medicine, Universitas Negeri Semarang, Honorable all Deans of all faculty in Universitas Negeri Semarang, distinguished guests, distinguished participants, esteemed colleagues, ladies and gentlemen. Good morning to you all. On behalf of the Ministry of Health, representing our Head of Health Policy Agency, today I will share with you the national policy on digital health transformation for quality health services. In today's rapidly evolving technological landscape, as we know, digital health solutions have emerged as powerful tools to revolutionize healthcare delivery. By harnessing the potential of technology, we aim to enhance the accessibility, efficiency, and overall quality of healthcare services for the people of Indonesia. Next slide, please. So, the government of Indonesia, as we know, has envisioned Indonesia Golden Vision 2045. It is a comprehensive roadmap for achieving sovereign, developed, and sustainable country. Health for all is a critical pillar of this vision, as it directly impacts the quality of our human resources. By ensuring that every Indonesian has access to affordable and quality healthcare, we are investing in nation's future and laying the foundation for sustainable development. Next slide, please. In 2023, we know that the Omnibus Law, the Omnibus Health Law, was enacted. This is a key milestone in Indonesia Golden Vision 2045, providing a comprehensive framework for transforming the nation's healthcare system. The law was further regulated through government regulation in 2024, which supports the 6 pillars of health transformations and aims to improve accessibility, quality, and efficiency of healthcare services. The involvement of both the government and communities in the implementation process is crucial for ensuring that these reforms are responsive to the needs of the people. Next slide, please. So I would like to show you that this is an overview of the pillars of health transformation in Indonesia, and many of the participants may have often seen the visualization of these 6 pillars, which serve as the foundation for the Ministry of Health efforts to strengthen the national health system. However, I would like to shortly brief this description to our discussion today. Committed to implement that encompasses 6 main pillars. First, the transformation of primary healthcare services, referral services. Third, the transformation of the health resilience system. Fourth, the transformation of healthcare financing. Fifth, the transformation of health human resources. And sixth, the transformation of presentation. We will focus on pillar number 6, the health technology transformation, which is a key element in ensuring the future success of. Yeah, this is the, well, we are focusing on the pillar 6, the health technology transformation. Next slide, please. So in the previous occasion today, in the opening, the Mr. Secretary has mentioned that Ministry of Health has AG in 2024. The Ministry of Health has Transformation Strategy 2020 to 2024 to achieve healthy Indonesia in collaboration with all actors of the health industry under the Indonesia Health Services Platform. We know that platform is named Satu Sehat. This platform, this Indonesia Health Services Platform, provides data connectivity, analysis, and services to support and integrate various health applications in Indonesia. So this is the platform to integrate all of the application. The focus on developing health data and health service application and improving health technology ecosystem is expected to improve the data quality and policies to ensure an efficient delivery of health services. Solutions for Indonesia to achieve a measurable and targeted digital transformation for the development of an integrated and sustainable healthcare system. We are currently in the process of preparing blueprint for the period of 2024 to 2029. Yeah, okay. You can see in the maybe in the presentation, you can see it in the Zoom platform that we have 3 main things that we mentioned in the blueprint for the period of 2020. Integration and development of health data system. The second is integration and development of healthcare application system. And the third is health technology ecosystem development. Next slide, please. So as of now, we are trying to overcome these various data and health system challenges. So we have 270 million Indonesians that have medical data in paper and digital form. More than 60,000 health facilities produce both paper and digital health data. There are 400 plus health applications owned by central and regional governments. And health data from IoT-based medical devices is not integrated and scattered. That's the challenges. And as a consequence, health data is not standardized and not integrated. Some of the same data is collected by different systems or apps. Interoperability and integration of national health data is difficult. Burden for health workers in reporting, as we know in our Puskesmas, we know that we have that kind of burden. And health policy is not yet database. So we try to address this by developing a Satu Sehat platform. Next slide, please. So we can see that Satu Sehat platform is expected to overcome these challenges the Satu Sehat platform is a digital transformation initiative by the Ministry of Health aimed at creating a more integrated and efficient healthcare system service across Indonesia. Well, maybe the participants already know that this Satu Sehat platform is already enacted also, but we still well developing it and make it better every day to serve Indonesian healthcare system. This platform connects various entities within the healthcare system, ranging from patients, healthcare facilities, the government, to the health industry, to ensure that all health data is integrated into one system that can be accessed easily and securely. First, for patients, Satu Sehat provides direct access to their personal health information through electronic medical records. Patient can view their medical history, monitor immunization, and receive better and more coordinated care. It is also facilitates for the continuation of care between different healthcare services, healthcare facilities. Second, for healthcare facilities, the main target of Satu Sehat is to integrate more than 3,000 hospitals, 10,000 primary healthcare centers, clinics, and independent medical practices across Indonesia. With this integration, healthcare facilities can exchange patient information quickly and securely, speeding up referral processes and improving the quality of services provided to the public. Third, for the government, Satu Sehat produces an integrated dashboard that facilitates real-time monitoring of health data. With this dashboard, the government can make decisions based on evidence and accurate data, which we refer to as evidence-based policy. This dashboard become a vital tool in health planning and policy making, including resource distribution, epidemic response, and the implementation of public health programs. Lastly, the health industry also benefits from the integration through Satu Sehat. This industry includes various entities such as insurance companies, health tech startups, laboratories, and many others. Through this integration, the industry can collaborate more actively in providing services that support the healthcare system, whether through the development of new technologies, the provision of medical devices, or access to the data that drives healthcare innovation. With this comprehensive approach, Satu Sehat will be the key to creating a more connected, responsive, and efficient healthcare ecosystem throughout Indonesia. The Ministry of Health is committed to continuing this integration to enhance the quality of healthcare services for citizens of Indonesia. Next slide, please. So this is to visualize that we have 5,054 health facilities across Indonesia that are now connected and actively sending data to Satu Sehat. In addition, 17,004 health facilities are ready to be integrated and will soon be joined the system. This integration process will continue to ensure that more health facilities across Indonesia are connected to the platform, enabling better data integration. As we can see together, this slide also presents a map showing the distribution of connected healthcare facilities across various regions of Indonesia. From the map, we can see that the connectivity of health facilities is expanding and will continue to grow until all health facilities in Indonesia are connected to the Satu Sehat platform. This will support the creation of a more integrated, efficient, and high-quality healthcare system across the country. Next slide, please. This is one of the examples of taking advantage of Satu Sehat data in the dashboard. We can make a evidence-based policy based on this kind of data. This is non-communicable disease dashboard in Bandung City. So this dashboard provides a comprehensive overview of non-communicable diseases in Bandung City. By visualizing data on various health indicators, we can identify key trends and areas for improvement. This information is essential for developing effective public health interventions to address the burden of NCDs in the city. Next slide, please. This is one of the major apps integrated in Satu Sehat platform. This is Satu Sehat Mobile. Satu Sehat Mobile represents a significant transformation of the Peduli Lindungi app into a comprehensive citizens health platform. By integrating individual health data, this app empowers users to manage their health records, access essential healthcare services, and stay informed about health-related information. With over 19 million users, Satu Sehat Mobile is playing a vital role in improving the health and well-being of Indonesia. Next slide. The Satu Sehat Mobile apps streamlines the registration process for Posyandu, enabling frontline health workers to efficiently identify cases of stunting. By automating data entry and analysis, the app reduces errors and provides real-time insights into children's growth and development. This innovative approach is crucial for improving the effectiveness of stunting prevention and treatment programs in Indonesia. Next slide, please. Another integrated app with Satu Sehat platform is ASIC, Aplikasi Sehat Indonesiaku, or the Healthy Indonesia application is a powerful tool for combating stunting in Indonesia. So this is by leveraging big data, this app enables real-time monitoring of stunting cases and facilitates timely interventions. Furthermore, it uses AI to customize and generates graphs based on recorded data and providing nutritional status and recommendation according to the predetermined data variables. This innovative approach is crucial for improving child nutrition and promoting the overall health and development of Indonesia's population. Next slide, please. So another application, so another way to integrate with Satu Sehat is also the electronic medical record interoperability with Satu Sehat. So we know in Indonesia now, right now, we try to push the use of the electronic medical record in real-time fashion. So all health facilities, we push them to use this electronic medical record in real time, facilitates with the electronic medical record registration to Satu Sehat, sending the electronic medical record to Satu Sehat, and also further develop of the electronic medical record integration to Satu Sehat. So when the data is already in this Satu Sehat, we can also analyze the data for many purposes, including avoiding the fraud of the health insurance in Indonesia, health medical insurance in Indonesia. And also we can get some kind of the health policy, evidence-based policy based on the data collected in the electronic medical record. Next slide, please. So that's the first part of the presentation is talking mainly about the digital transformation in the data information. This slides begins to talk about the biomedical and genome science initiative that has launched by the MOH of Republic Indonesia on 14 August 2022. This initial initiative comprises of National Biobank, integrated registry system, genomic sequences, and genomic sequencing services. Next slide, please. So in the future, we are expecting that the medicine is taking the path of the precision medicine. So the BGSI act as a catalyst for accelerating the implementation of precision medicine in Indonesia with a genomic approach. as of now, starting with screening for 6 diseases and pharmacogenomics for 2 conditions. And the hubs is the hubs are various hospitals in Indonesia, and in the and in the future, this initiative, we hope that we expect this initiative will be advancing in the future. Next slide, please. This BGSI is integrated. The data of the BGSI is integrated in the Satu DNA platform, which is still being developed. And this Satu Sehat DNA platform will gather the data from BGSI and integrate it with Satu Sehat. And Satu DNA platform combines clinical and genomic data. We can see in the next slide that how this Satu DNA platform ecosystem is visualized. So the data from the patients, the public, and the program will be gathered into the Satu DNA recruitment. So it will be recruited in that Satu DNA recruitment. And then the individual data will go to the Satu DNA registry and also Satu DNA biobank and Satu DNA bioinformatics, which is then portal data and aggregate data. So we can see it in the Satu DNA portal data dashboard. We will be seeing it because the one with the gray color is still being developed. So we are expecting this kind of initiative will be advancing further. And as we can see, this is also connected with the, okay. Another part of this presentation is we are trying to convey the message that the Indonesian Ministry of Health is collaborating with various companies, including this Harrison AI, to explore the possibility, the probability to the implementation of AI in diagnostics. For example, implementation of AI in X-ray to detect lung cancer and TB, implementation of AI in CT scans to detect stroke, and implementation of AI in pathology. Okay. So this is my last slide. Yeah. And in this last slide, we also would like to convey that we are also in the process of making the regulation to bring health services closer to the community by utilizing information system technology in the substance related to telehealth and telemedicine. So as we know that in COVID-19 era, pandemic era, we are seeing that many of the telehealth and telemedicine practices has been done, but we in post-COVID era, we have not had some kind of regulations to have some kind of certain rule how is conducted. So we need the comprehensive regulation governing this telehealth telemedicine, and as of now, we are still processing the regulation. So yeah, well, this is my presentations, and maybe in closings, I think it's not overrated to say that you might have a lot of questions and I might not have all of the answers, and it's not overrated to say also, I think, yeah, maybe I can say that let us learn together. So let us learn together. Maybe let us Google together. Thank you.
Thank you, Dr. Armanji. It's such an insightful presentation from you that you said about the policy on digital health transformation strategy in Indonesia. And I also have so much information about the Satu Data, Satu DNA, and all of the things that you have mentioned previously. And please once again give a big applause for Dr. Armaji. Okay, once again, I would like to remind all the audiences here, both in online or offline, if you have any question, you have just keep your question first for the offline audiences, and for the online audiences, you can write your question down in the chat box, and later we will discuss to our speakers in the discussion session. And next agenda, we will have the second speaker here, Associate Professor Eng Yi Hyung. He is the Director of the Digital and Smart Health Office for the Healthcare Innovation and the National Healthcare Group, overseeing the Hospital Without Walls program, digital enablement and adoption, digital transformation and the health empowerment by AI Launchpad initiative, focused on adoption and scaling of artificial intelligence across the NHG. He is also a faculty in digital health and AI with the Lee Kong Chian School of Medicine, Nanyang Technological University, Singapore, as well as the clinical director of the LKC School of Medicine NTU, World Health Organization Collaborating Center for Digital Health and Health Education, and at the Tan Tock Seng Hospital, Singapore. He is a senior consultant, Department of Preventive and Population Medicine as a public health physician and supporting the training of emergency physicians in evidence-based medicine. And his research interests include resuscitation, emergency medical services, innovation, and the adoption of digital health and AI. And today, he will share the insight about opportunities and challenges of digital transformation of health to ensure a resilient health system present and future. So let's just start the presentation. For Associate Professor Eng, the time is yours.
Thank you very much, Amelia. Let me just share my screen and let's see. Okay. Can I check that you're seeing the correct view? Amelia, can I check that you can see the correct view from my screen?
Yes.
Okay, great. So we'll begin then. Thank you very much for the invitation. And I'm very honored to be invited here to talk about this area. It's an area of interest. And thank you for the kind introduction. I have no conflicts of interest to declare. I work for a public healthcare institution, which is a national healthcare group. We take care of 1.5 million residents in the central part of Singapore. Very small compared to Indonesia, just a fraction. But I'm also a practitioner in terms of helping to develop digital health in the healthcare system in Singapore, as well as practicing, practicing public health physician. So I'm going to do this in two parts. One is about the opportunities of digital health, in today's world, as well as some of the future things that can happen. And I think from the last speaker's presentation, it's very clear Indonesia is on the right track, looking at data, looking at digital platforms, like the Setuhat mobile app. So with this space, right, it's clear that healthcare would benefit from all these new things in digital health. And the Economist had done a poll and a survey, and it was very clear that there are a lot of opportunities that are unclaimed, in healthcare in terms of digital transformation. And this was done quite some time ago, and the World Economic Forum also recognizes the fact that there are many things that are still, continues to be a challenge in healthcare. We now talk about the fourth industrial revolution, the first one being steam engineering, the second being mass production, like the Henry Ford Model T, and the third being computerization. And now, with the things that we are seeing with AI, mobile technology, we call it the fourth industrial revolution. And there are many different pieces of things that are part of this fourth industrial revolution, ranging from mobile devices, IoT, GPS, and I'll talk about a few of these types of services and what some of the impacts that we are seeing in Singapore. And I think many of them are actually very much applicable to Indonesia and many other countries in the ASEAN. This is one of my favorite slides, that I like to talk about personalization. The fourth industrial revolution has allowed us to do many more things, right? And often we tend to see things from a very provider-centric view, provider meaning the system, the healthcare system. But we don't do this enough in terms of helping patients to navigate their health. We give them so much information, but often the patient struggles to understand the health. And I think now with AI, and in particular generative AI, has made it even better than Google searches, right? You can go chat GPT and it can explain to you what a complex set of test results mean to yourself. And it's only when our patients understand their health and they can navigate their health, then they can understand what type of resources, right, would be relevant for the health problem or the health challenge that they're trying to solve. Because ultimately, right, in most healthcare system, the cost of healthcare is increasing. In the US, in OECD countries, in ASEAN, in Singapore as well. I mean, although Singapore likes to say that we managed to keep healthcare costs fairly low, it's about 4% of the GDP spending, but we also see very significant rises in the last 5 years, especially with COVID. So for patients to be able to become smart consumers of healthcare, first they need to understand the value of the care as well as the cost of the care. And this is often not very transparent when you come into a hospital. I used to work in the A&E. I was an emergency physician for 20 years. And the biggest challenge, of course, is that beyond paying a fixed fee for emergency care, for patients when they're admitted to hospital, even with financial counseling, the range of prices that you might end up paying in Singapore is staggering. It can be 100 to 200% difference. So we really want to evolve to a more personalized healthcare, right? Where we to me, I think the what you see in retail, right? Where in the old days you started off from a single channel, multiple channel to cross channel, and now what they call omni channel, sort of like a digital experience. We do want this to be part of how it works in healthcare. A very easy example to understand of omni channel is when you use Netflix, right? You can consume Netflix on your phone, you watch it for like 20 minutes, you can move to an iPad, move to your TV, or even move to a game console, and it stops exactly where it is. And the devices all share your data such that they recommend exactly what you would like, over time. Um, I mean, in Singapore, we are slowly moving towards a multi-channel delivery where, you can access some of the care through through an app, through a kiosk or in person, and then the delivery can go to, let's say, for example, home delivery for medications and other things. But it's not really the full solution, of course. I mean, the ultimate idea of an omni-channel in healthcare would really involve, being able to cross-link the services from home retail, the patient, the healthcare provider, wellness centers, for example. But of course, to do this, it really requires a very sophisticated way of integrating your data and for interoperability and common standards as well as security such that these things can work together. I'll move on a little bit to more to the artificial intelligence space, right? As you know, the last 2 years, AI has been the hot topic in all industries, including healthcare. I mean, AI is a very generic term, and then we move into other areas like machine learning, deep learning, and of course, the topic of the day, which is generative AI. It's really something that has transformed many industries, and I believe in healthcare, this is likely to happen as well. So, I'll give you an example of deep learning, and this is just something from one of our local meetings. Photoplatismography. It's basically using a deep learning algorithm, right, which allows you to take a short 10-second video, loop that allows you to measure actually the heart rate, respiratory rate, as well as blood pressure. And in the works, right, Blood sugars, cholesterol are things that potentially can be correlated through deep learning. And there are many other providers and people developing these ideas. Apple is trying to do this on a watch as well. So I think things like these style IoTs, right, potentially have ability to scale to the community where people can measure without even buying a blood pressure cuff, for home monitoring. So I'll move on a little bit more into the generative AI space. And of course we know that the last 2 years have been quite amazing in terms of adoption of ChatGPT. We can see that Netflix took 10 years, Instagram took like 3 years. ChatGPT literally took weeks to hit I think 100 million users. And it's quite amazing how fast it's been moving. And what can we do with generative AI, right? Generative AI seems to be quite an amazing tool because it's a AI model that is trained that can be used for almost anything, and you need to just use some simple text without programming to shape how you want to use it. So patients can potentially use it as a virtual assistant. Hospitals can use it to improve workflows. We can use it for clinical decisions, medication reminders, and then technically even data scientists and coders are starting to use it for various things, generating code, extracting data. So a lot of potential users, but let's see how some of this pans out in practice. This is an example of ambient AI. It's used in Epic, which is a US-based system.
Excuse me, sir. Excuse me, sir. Is there any sound for this video? Because we couldn't hear your video's voice. Excuse me, sir. Is there any voices for the video that you present? Because we couldn't hear any voices from the video that you share.
Okay, so this is an example of a US-based system, Epic, which Singapore is using, and DEX is what used to be called Dragon Speak Easy. For those who are radiologists, may recognize the brand name because DEX used to be for transcription, for medical reports like radiology report, but now it's become so sophisticated with generative AI that you can have a conversation with a patient and it will summarize into notes. But of course, we recognize that some of these type of services are incredibly expensive. Even in Singapore, when we are trying to implement similar services, we recognize that some of these are quite costly. But we've actually done interim versions in Singapore. We have a version called Note Buddy that is locally built by our own IT office that we are starting to trial. So it really just runs off ChatGPT in our system, and it doesn't require a very high cost subscription to a US company. So these are, you have subscribed to ChatGPT services, which is fairly generic, but otherwise, it is much lower and it's possible to build, locally. So there are many other uses of, generative AI. This is an example from a colleague in Europe where they've been using generative AI to generate pictures to use in teaching. So there are many use cases in education. This is using it for brainstorming, where I actually generated these images myself on a futuristic ambulance or futuristic paramedic. Some of these are very nice conversation starters, but of course, we can look at other more practical users like this. Generative AI, like let's say image or video generation, right, can be quite powerful. This is an example actually done by a ex-pharmacist in Singapore working for Boston Consulting. He actually deep says on a YouTube video. His name is Kenneth Leong TY. You can actually Google his GitHub. handle, but he generated a pharmacist avatar to do medication counseling. So the idea is very interesting. He did it into a bunch of free services, but you can see the potential of it. Let me just play it for you to take a look. So this is completely Gen AI built, and if things like this can scale, right, you can save your pharmacist a lot of time from having to do medication counseling, especially for simple cases. Take a look.
Di sana.
So you can see an example like this from Macy, right, which is a AI generated pharmacist, and it can be done in all sorts of different shapes and sizes, and in terms of creating the script, right? This is all written by generative AI. Of course, it was checked by actual pharmacists before they did the text to speech conversion, and you can use it to generate advice for all types of medication that's commonly dispensed in a pharmacy. So these are potentially time savers. This is a service in Singapore called Mindline, again also using generative AI. So this is a cognitive behavioral therapy chatbot that is a collaboration between the Ministry of Health Transformation in Singapore as well as the Institute of Mental Health. So IMH is a national organization within our national healthcare group, and they take care of mental health and psychiatric illnesses in Singapore. So they created this Mindline chatbot, and I think within a year or so, they had about 800,000 people logging on to use it, for de-stressing, wellness tips, anxiety, and very, very quickly at a very low cost. I'll move on to geospatial services, right? So, with the fourth industrial revolution, there are many things that you can do with location services, from mapping out people who are at risk, vulnerable to certain illnesses or in need of, let's say, health service access. This is an example done really quite long ago. 15 years ago, I used to work with the ambulance service as well, and this was done by a colleague of mine who was mapping out areas where it's very poorly covered. So using very simple GIS services, we redistributed the ambulance locations, and we realized that many more citizens could be covered, just by redistribution and being able to see the coverage. And this was a very old time type of technology, drawing a circle, and today it has become much more sophisticated with digital transformation. Take a look.
Excuse me, sir. We couldn't hear any voices from your video. Could you please setting the sharing?
So, as you mentioned cardiac arrest, and I think these are examples where really data being used, right, can help you, get to cases much earlier. This, in Singapore, we've actually also used GPS and GIS location services to help us reach patients faster. And this is really using mobile apps connected, to the 995 call center. So you can see apps like this, right? Using GIS technology, and integrated to, with the right type of use case can potentially, support emergency care. And this app at the moment, we have about 180,000 Singaporeans on the app, and annually we save about 300 people from cardiac arrest, in Singapore. And the app helps to get the bystanders in before the ambulance arrives, because in Singapore an ambulance takes 10 minutes, which is too much time, without CPR. But with a volunteer, in about 4 minutes they can come to the scene and start chest compressions, or get an AED before the ambulance crew arrives. And of course, there are many other technologies which we can talk about. Here is an example in the Center for Healthcare Innovation, right, where we use virtual reality to train people in decontamination when patients arrive in the emergency department with a hazardous material, situation. So we are training staff on the processes, because this is something that is very rarely encountered, and you won't really see something like this. So we virtualize the process of how to scan a patient for hazardous materials, and then how to use the decontamination, or rather, sorry, the hazmat detector. And that way, it allows us, to train large numbers of people. This is the actual exercise, in our emergency department. And this is when it's done to prepare for an incident. And there are many other examples of how, virtual reality, or even mixed reality, in this case, and this is with the fire department. So it's to train people in things that are, rarely encountered, high risk situations like firefighting, emergency rescue, and things like that. Yeah, I'll move on to something related, which is medical 3D printing. This also happens at the Center for Healthcare Innovation in Singapore. Essentially, our surgeons are also using 3D printing, and let's say using scans from MRIs and CT scans. You are able to use it for patient education, surgical planning, and also for pre-op planning as well, where you can print a pelvis that is reconstructed and use it to bend the surgical plates and screws as needed, so that when you do the surgery, the time it takes is much shorter. There's also many things with the telemedicine space, right? Telecollaboration, treatment, monitoring, telesupport that can be done, right? In the hospital, sometimes between patients at home to the hospital to the clinic, or between doctors, different types of specialists, that collaborate, with different skills. Not everyone has the same skills, especially on call at night. And also with the pre-hospital care system, the paramedics have access to telemedicine with the hospitals as well.
Excuse me,
And
sir.
yes,
You have minutes time remaining.
okay, sure, understood. Yeah. So so in terms of telemedicine, there are many different things that we can do, right? In terms of helping to get data using across the system to be able to allow us to collaborate. Okay, I'll skip a little bit through this very very quickly about blockchain. It has some users, and we've used it in COVID quite successfully, right? Where using blockchain allows providers with a lot of different data systems to have that same common understanding, whether it's your vaccine data, your delivery data, and then when your vaccines are done. Then I'll move on to my last bit, which is about challenges, in this whole, digital space. When we want to transform, there are a lot of challenges, right? For example, when we talk about social determinants of health, we know that there are many factors that impact whether, how our health is. Healthcare directly is 20%, but there are many other factors. But when you move into a digital space, we need to think about a digital determinants of health, because you need health literacy, you need communication technologies, access to equipment, broadband, internet. Otherwise, right, you cannot have digital health transformation. And some of these elements, right, the devices, the training, the support, the content are all an important part that we need to think very hard about. So, having access to all these things, equipment, is very key. Oops. Yeah. And Oh dear. Yeah. And in certain groups of people, right, there are challenges where they are underrepresented and health data, what we call health data poverty. Specialized group, women and children, often there's not enough research data, evidence-based data, vulnerable groups, and different, and when you have these issues, right, you may have biased data, and this is very important when you move into the AI space. And I think, as was pointed out by my earlier speaker, there's so much healthcare being generated today, and that a lot of the data generated has really not been used still. So we're really facing this type of data tsunami, right? Even the WHO has a name for it called infodemic. That how do people tell when there's so much data what is correct? What do we use? And then this is of course a commonly cited problem. Data is the new oil, but can we refine it and use it? Because not all data is the same, right? It's like crude oil. You can't use it. You need to make it into products. So all these things with data extraction, data cleaning is a real problem if we want to be into the digital transformation space. In Singapore, we are also struggling. Currently our situation is that we have so many different layers of data system. We are trying to move into a unified platform to allow us to be able to be more effective in sort of digital transformation. And then only when you have interoperable data, you can do many more things in terms of wanting to transform care. Okay, I'm going to skip through a couple of these slides. I'll bring back to this part about generative AI because it's been such a huge topic these few days, right? That generative AI also suffers from the challenge of biases. Like, for example, when you generate pictures, right? Let's say if you ask, let's say ChatGPT or some sort of image service, right? What does a doctor in Singapore look like? You will see that you have a gender bias, you have racial bias. In the US, it's the same. Even when I generated a face of a doctor in Indonesia using something called Midjourney, you have almost entirely male doctors, being generated. So I think a lot of the data systems, right, we will suffer from inherent biases that we have to be aware of, and then to be conscious of that when we deal with this. So, to be able to work in the digital transformation space, we also have to be aware the larger the platforms we build, the more risk that we may suffer in terms of people wanting to attack your data, because healthcare data is worth a lot. And that, to secure the data, right, nowadays people are starting to create more and more complex passwords. Nowadays in Singapore, every single password in my healthcare system is 12 characters going to 15 characters already. Yeah. And even the use of generative AI creates quite a few challenges in terms of the fact that, like, for example, ChatGPT takes your data when you type things into it. So there was a case where Samsung workers in technology fed in their proprietary code, and then after that, it was discovered by other people. So there is a need for certain systems, like, for example, secure ChatGPT to be able to ensure that your data doesn't leak. And I think last few things is that, um, hang on. There is a issue of environmental costs. Training generative AI models can be very, very expensive. It actually has a huge carbon footprint. And these are the common challenges. I'll bring you to my very last challenge and my last couple of slides, okay? That translating, all this digital transformation into services is a huge challenge. They call it sometimes the valleys of death, right? From bedside to knowledge and from knowledge to practice, right? There are a lot of challenges with scaling. This is an example where we scaled an AI model for eye screening. This took about 10 years for this to go into general practice, from the time the idea was developed to the time it really scales up. And we know this because, right, innovators are really a small part of the equation. Early adopters, will hit you about 20%. By the time the early majority adopts, it's just half of the people. But if you need the thing to really scale, you need to get everybody. And this is the part where this is a process that takes about 10 years, very often in healthcare. And to transform care, right, you need to get to a point where the service becomes cost effective enough. Early adopters are willing to pay even when it's not cost effective. And it's only when it gets to a point where, it is commercially quite viable that when the bulk of the majority of people will adopt such services. And when we look at generative AI, we are probably somewhere here because it's become so easy for people to use. For things like telehealth, it is definitely past that point. And for things like VR, it's very early stage. GIS, very much there. So I will just move to my concluding slides. Just give me 2 minutes. Is that okay? 2 minutes? All right. Okay. So I think to be able for us to use AI digital health, right, we need to have very strong for AI in healthcare, involving the regulators, involving patients, involving our systems itself, and that's something that I think, really will help us. And for us, we've been shifting towards all these concepts of organizing the systems, the governance for that to work. And we're doing a conference next year in Singapore called CHI Innovate next July. So if you're interested to learn more, this is something that we're doing next July, 10th and 11th. So I'll summarize. The fourth industrial revolution is something about systems and connectivity. There are a lot of things that we can do, but it really does require good data, interoperability, and platforms. And for us to focus on governance, quality data, setting up the platforms, and also very conscious about organizing adoption of AI is really the way to go if we want to take advantage of, all these digital transformation concepts to turn it into services that will serve our population. So thank you very much. I'm sorry I overran by a couple of minutes. I hope that's all right. Thank you.
All right, thank you for Associate Professor Ng. And give applause for our speaker here. Yeah, so after the two speakers has finished the presentation, we will continue to the discussion session. So I will invite all the audiences to have the question for our speakers. And the first one, I will invite one question from the offline audiences here, and also one question from the online audiences. Maybe anyone here, if you want to ask, you can raise your hand and ask your question, or maybe we can check the online first. The operator, can you help me for check the chat box? Okay, is there any offline audiences who want to ask? Okay, please, can you help? Please say your identity first and then say your questions clearly.
Okay, thank you. Good morning, everyone here. Okay, I want to introduce myself. My name is Soidin, post from Faculty of Medicine in Unnes, and I'm from Tangerang. First, I would like to question for Ministry of Health Indonesia. Mister, this program Satu Sehat is a health detection ecosystem maybe that is connect information system for all health facility, Pasienkes. Okay, for this advantage, what are the advantage and disadvantage of this system maybe? And how to take a step in the event of an unwanted event with the integration of this system vulnerable to data breach, yeah. Crucial data maybe yeah, maybe it's very big data maybe it's, yeah. How about the safety about this? It's very okay, maybe thank you very much for this. And for Mr. Professor, Professor Eng in maybe I'm sorry. This is interesting. This technology provide convenience to us, including in the current health system, slowly leading automation and integrative, where the role human will reduce, yeah, as it see maybe reduce role of human to machine. Yes. How do we deal with this kind of condition in health? Yeah. Does there need to be second opinion for diagnosis to avoid mistake, maybe for the health, maybe second opinion between machine and human, maybe. Thank you, Mr. Professor. Thank you very
Okay.
much, Prof.
Thank you. So we will move to the first question first for the Dr. Armaji. Is talking about the Satu Sehat ecosystem that maintain about a lot of data, and maybe if we remind several months ago, we have some issues about the data privacy. So what about the safety for the data and the Satu Sehat? So please, you can answer the question.
Yes, this is a very technical question, and I'm trying to answer as the best as I can. So the data transfer from the healthcare facilities into the Satu Sehat should use the API access code. So this is the abbreviation, the API access code. And this API access code is very highly classified. Only the people from the healthcare facility knows how to use it to input that data to Satu Sehat. So maybe in short, that's the answer for the question. In short, but maybe we can also take advantage of the information that in building the Satu Sehat, the developer is committed to follow the certain rules, the certain standards of international standard of data transfer. So that kind of standard we can find maybe in WHO sites, European sites, European country sites, etc. And by following that standards and using that highly classified code to access Satu Sehat from the healthcare facility to Satu Sehat, well, those efforts might, make it better in security and in privacy of the data into the Satu Sehat platform. Thank you.
Okay, thank you, Dr. Armaji. Maybe we can less worry because for the Ministry of Health, as Dr. Armaji said that they prepared a lot about the data protection, so we can sure that our data is safe from the application.
I want to know about the secondary data for my research, maybe where I want to get this, maybe.
Yeah, as of now, this Satu Sehat platform is connected with the Dinkes Kabupaten Kota, in English, the health office in the government in the municipality and the cities, and they can have that kind of access of their data. So that's what I know as of now. They have the access, the Dinkes, the health office in the municipality, and also the hospital also has that kind of access to their own data. If they put their data into the Satu Sehat, they can have that kind of access. They can communicate with the admin, the administration in Satu Sehat to get that kind of data. So your question, how you can get that secondary data? Well, my answer for now, maybe you can try to coordinate with the Ministry of Health to get that kind of data. Maybe send us some kind of letter to try to have that kind of aggregate data. Maybe we cannot give you the data in persons, right? Because it's strictly classified, but maybe you can send us. And also, in Satu Sehat mobile platform, each individual can have the information about their medical record. We plan to have that kind of access. So, well, maybe to answer that your question in the correct manner, maybe we can have further discussion about that. I don't have all the answers for that for now, but for now that's my answer. Thank you.
Thank you, Mr.
I think it's
Thank you.
clear.
We have to maybe coordination with the
Yes.
health department maybe.
Yeah.
Thank you very much.
Okay, thank you, Dr. Armaji, for another answer. And we will move to the next question to Associate Professor Ng. If I highlight the question, so he's asked about the issue that technology would replace the role of human as the practitioner to manage the patient. How do you think about this? And
Yeah, yeah. Thanks for asking the question. I take it that the worry and the concern is what if AI or digital technology replaces the healthcare worker. I think that is to me I think it's unlikely to happen. We do see there's a lot of technologies being implemented, right? Like I think I highlighted the eye screening in Singapore, where we implemented at a national level. So what used to happen is that you have to queue up for very long but now we rolled it out to the polyclinic. So it's now in the GP and community setting where many more people are getting their eyes screened. So we are picking up diabetes, hypertension, where it's starting to affect the patients at a much earlier stage. And in the end, right, most people get screened. About 90% are screened normal or under good control, and it's only the 10%. So we've reached out to many more citizens with the same number of optometrists and eye doctors, right? Because they're only focused on the ones that the AI has been helping to do the screening. So I don't think the doctors, the nurses, the optometrists are losing their jobs. In fact, we are just being able to reach more people. And I think the challenge is that in this setting, we are seeing aging populations all over Asia where more and more people need healthcare, and there's often a shortage of healthcare workers. So I think AI will change our jobs. I don't think people will lose your jobs, per se, but your jobs will definitely be changed. I think you may see healthcare workers worried about losing their jobs only if you're not prepared to evolve, with the current situation and pick up new skills and take up new roles in the healthcare system. Because I think we'll all be expected to take on more challenging roles, and very basic, simple things we will automate with AI. And I think that is what's likely to happen. So the important thing is to keep learning and to keep picking up new skills, and then to be prepared to take on different types of healthcare tasks as a healthcare worker. Actually, I would say these are the high value jobs, and let AI do the simple things.
okay, thank you for Associate Professor Ng. Maybe it's clear enough that the technology, maybe, sorry, because the time is limited, so we will decide to limit the question. And maybe if you have any more question for the speaker, you can deliver this question to us, and we will deliver the questions to our speakers and have any other discussion other than this time, because the time is limited. So we will finish for this plenary session. And thank you very much for the two speakers here. And maybe before we close, I would like to invite the speakers to have the closing statement. Maybe first from the Dr. Armaji for the closing statement. Just keep it simple.
Yeah, well, I have stated my closing statement earlier in the presentation. I think I said that it's not overrated to say that let us learn together, because you might have many questions and I might not have all the answers. Thank you.
Thank you, Dr. Armaji. And then for Associate Professor Ng, you can give your closing statement.
Sure. Yeah, I think there's a lot of possibilities in digital transformation, and I think it will be very impactful in Indonesia as well as many other parts of the world. So, as I mentioned, we need to move into better data, collaboration, to be interoperable with the data as well as platforms, and that will be the way forward for digital transformation.
Okay, thank you, sir. And finally, this is the final discussion for this session. And for ending the session, finally, I, Amelia Fitra Hasana, bid farewell. Thank you for your attention, and I will return the event to the MC. Wassalamualaikum warahmatullahi wabarakatuh.
All right, thank you so much for Dr. Amelia Fitra Hasana, MHPE, and all the invited speakers for the interesting presentations and discussion. Ladies and gentlemen, we're going to move to the next agenda, which is the second plenary session. But before that, there is a reminder for all the participants and presenters to fill out the attendance, which can be seen on the screen. All right. In this plenary session, there will be two speakers. They are Professor Shabir Syed Abdul and Visa Nuruk Hantawi. This plenary session will be moderated by Ms. Anissa Aulia Safitri and Clean Farm. Ms. Anissa completed her MADI. Please welcome with big applause.
Okay, thank you for the MC for this given time to me. And our Assalamualaikum warahmatullahi. And also I want to greet the participant who has joined in the Zoom. I hope you're still staying with us. Okay. Okay, still staying with us. Okay. Okay. Good morning, ladies and gentlemen. My name is Anissa alias Safitri. I'm from Pharmacy Study Programs of Faculty of Medicine, Universitas Negeri Semarang, and I'm being honored to be getting this setting and discussion session in this in the second plenary session. Okay, for the first, I would like to greeting my excellent speakers today. Good morning. Can you hear me clearly?
Yes, very well.
Okay, and then I also want to greeting our second presenter today. Good morning, Dr. Nook. Are you connecting with us?
Yes, okay, good morning.
Okay, thank you for confirmation. Okay, all the participant, I will explain the rule first. So this second session will be divided into this two sharing session. Each session will be held maximum 25 minutes, and then we will have discussion session after. For the first, we would like to have sharing session with Prof. Shabir Syed Abdul from Taipei Medical University. It's my great honor to introduce our esteemed speaker, Prof. Shabir Syed Abdul. Prof. Shabir Syed Abdul is a professor in a Graduate Institute of Biomedical Informatics, College of the Medical Science and Technology, Taipei Medical University in Taiwan. He is a renowned expert in the field of the digital health with remarkable track record in leveraging technology to enhance healthcare delivery and promote health equity. With the background in health informatics and deep commitment into innovation, Professor Shabir, whose expertise in AI, wearable devices, and the Internet of Things in healthcare, has been instrumental in advancing digital health solutions that empower individuals and communities. His exceptional accomplishments have earned him as a prominent position among the top 2% of scientists worldwide. His major research interests revolve around AI, big data analysis and visualization, and then long-term care with the wearable technologies, mHealth, personal health records, social network in healthcare, and hospital information system. Prof. Sabir has contributed significantly to the both academic and practical discussion around the digital health. We are excited to hear his insight to the future of the digital health and how it can thrive meaningfully in health transformation. So, ladies and gentlemen, please join me in welcoming Prof. Shabir Syed Abdul. Please give him applause.
Thank you. Thank you so much for detailed and elaborated introduction. So first, I am really privileged and honored to be sharing my knowledge and experiences with you people. Hope you are listening to me and you are seeing my slide, right? Perfect. Okay, so to begin with, and you will see we are overlapping and we have so much things synergetic. So you will be really understanding what we wanted to say. So let's start with introducing Taipei Medical University, which is one of the private medical university in Taiwan, and it has a top position. And as you see, we have 6 teaching hospitals, including the cancer center. And this is the basic research which we are doing here, that is bioinformatics, Internet of Things, decision support, precision health, and AI in medicine, of course. Then our colleague before were talking about fourth revolution, industrial revolution. So I want to talk about fourth healthcare industry innovations, right? So X-ray was one of the earliest innovation which changed the way we used to practice healthcare. Then comes the antibiotic, and then comes introduction of this CT scan, MRI scans, all those things. And now we are talking about big data, AI, digital solutions. So these are the 4 different like innovations so far that has been changing the way we are practicing, the way we are delivering healthcare. And I want to just get back to the one of the slide of our Professor Yang. It was about nudge theory. Actually, it's also very important for engagement and empowerment of our patients, because prevention is all about it. So let's move and see what are the challenges or what are the changing needs of our healthcare. That is prediction and prevention. So we no longer can wait at hospitals and wait for a patient to come with the problem. It will be too late. Therefore, we need to start prediction, then prevention. And in order to do this, also we need to empower and engage patients. How we are going to do that is where we use actually nudge theory. If you guys don't know, it's very good book. Architecture, which is was there one slide, but because of lack of time, the professor has to run away with that. But that is really good. What is a book for you to engage your patients and see how you can empower them. Then the third thing which we really need to consider is generalized medicine to personalized medicine, because right now still we are practicing generalized medicine, right? So we want to get, now we have enough data of the patient, we know exactly what he or she needs. Depending on that, we can change our practice into personalized medicine. And then we want to focus on long-term care for chronic disease management. As our previous again speaker was emphasizing, how different type of tools are used for long-term care, chronic management, diagnosis. This is all about digital health and how we can transform on ground. And then we want teleconsultation of patients to travel a lot. They come to the doctor just see, okay, continue same treatment. How many times it happens? Often. Then why that type of patients continue the same treatment? And which we do analysis and we use DSS and serve the patient. But now we want to move with wearable device. Why? Because we need to know what's engage patient in maintenance of their own healthcare. Because unless until we own healthcare, because unless until we get this participation, we cannot provide what you say very good healthcare. Patient need to participate. Now, what is the mindset of the patient is, my problem is doctor problem. I need to talk to them. The doctor will decide what he need to do, and I just follow. But the problem is adherence and compliance with the treatment. They don't even follow that. They come back, they take medicine for 2 3 days or whenever they want, and then they throw rest of the medicines. And if this happens with antibiotics, superbug is something waiting for us, and it is already happening. It's not thing new. Then I want to talk about this very important component, because when we take birth, we have three different this thing. 1 minute. We have three different healthcare. I don't know what's happening. I need to. This happens before also. Genetic information, we cannot change anything, but environment is where we born. We can born in developed country, we can born underdeveloped country, we can born where there is air pollution, water pollution. Although little bit is in our hand, but we cannot still go away from our family for having better environment. But the third one is behavior. That is all about our lifestyle, how we are managing our lifestyle. What, when you are eating, what you are eating, are you smoking or not, are you consuming alcohol or not, when you are going to sleep, how much you are doing physical activity. All these things depend upon us. Now imagine if a patient has a risk of lung cancer, he has the risk, so we can't change that. But when it comes to environment, this will affect. If he still continues to live in polluted, air polluted space like area, then the chances of him to get cancer will be earlier. At the same time, if he smokes, if he do alcohol, consume alcohol, then much faster, in 20 30 age of 30 years, 40 years, he will get cancer. However, if he avoid this environmental and behavior, change the behavior, a healthy lifestyle, he can prolong the onset of the disease. Second thing is early detection. If we cannot prevent, at least we do early detection. If we cannot, early detection is the, so that if we diagnose any cancer at stage 0, it will be much easier for them to, cure the patient. So this is very important component we need to understand. And here comes in nutshell what this means. Radiation is there, air pollution is there, diet is there, drugs are there, stress are there. You see how many different factors affecting our needs and our our health actually. So we don't know the water we drink, how it is. We don't know the oil we are eating, how it is. So there are so many different things which we need to take into consideration. And I want to say this, that is, for intelligent, smart healthcare, we need to have everything interconnected, interactive, responsive, adaptive healthcare. We need to use wearable device. It's not only just using, how the data is used is very important. Are we giving real-time prompts to the patients, or we are waiting to collect data, then do analysis, then after 1 month replying them? That doesn't help them. That is why we need wearable device with edge AI. Then we need some AI which is working on background and telling the nurses and caregivers what is happening with the patient. At the same time, we need to have environmental sensors, monitor sensors, air quality sensors, because once we combine all these sensors, then only we can provide, can manage to provide better healthcare, I can. And then the another big problem, that is, although we have thousands, this is only 2020. In 2024, it's like more than 10,000 to 12,000 papers have been published on AI. But the question is implementation. How much we are implementing? This is the key. What is point of me as a professor publishing good models, ML models for predicting chronic kidney disease, some cancers, all other things, but we are not taking into practice. But there are if problems for doing that. What is this? Although we need this FDA approval. Without FDA approval, we cannot use in clinical practice. But to get this FDA approval, as a professor, I need to undergo lot of legislation, rules, regulations, what you say, verification, validations, standardization, approvals, and we need to spin off company. There are huge problems. So next slide is all about these problems. So you need to know what are the trends, opportunities of AI in healthcare, where we can already develop, what are the real challenges, what are the opportunities, and what are progressing happening. If you see a lot of progressing happening in image interpretation, because obviously that is easiest part. Then again, FDA approvals, they are improving how to fasten, expedite the approvals of, we call it like software as medical device, SAMD, right? And then also you guys should know what are the opportunities so that you can focus on those type of fields so that you can get early results. And now I will be giving some example and finish. I think I have enough time, right? More? So this example is something related with what is happening in Indonesia, that you are promoting, you are opening, you are engaging public. My Health Bank, it's a Taiwanese government project where they want, because you need to know Taiwan has single payer system, where the data from all 23 million population goes to one data center, and they have doing this from last 25 to 30 years. So you can imagine how much data is there. And AI is all about data. The more data, the better AI you can do. So we say like we have like gold mines of data in Taiwan, health related data. So that is exactly what this National Health Insurance Research is focusing on. And they are using ML AI for doing personalized prevention, prediction and prevention, cancer prediction. How they do is, number one, so this they provide access to all their population just by using the health card. You can get into your EHR and see how many times you went to hospital, what diagnosis they did, what were your lab values, even images are there. Plus, you can add your personal information like blood pressure, heart rate if you want, body weight if it's changing, everything you can add to this. So they made it like personal health record. And then this is that interesting part, that is disease assessment. Here, since they already know how many diseases, comorbidities they are having, they can predict the risk of two diseases, liver cancer and chronic kidney disease, because these are very, what to say, uh, serious lifelong diseases. Therefore, they want not to waste lot of money on this. Therefore, they should start with prevention, prediction, prevention, or at least early detection. I think this is the most important thing. But however, the problem with preventive care is it's not visible target, because if I say you to do exercise and sleep well, you will not get cancer. How many people will trust that? And how many days you will be going to do that? So it's like repetitive and slow. We cannot see what is the benefit unless until we manage to get it. So many may not get the cancer. So is this because they are practicing healthy lifestyle, or it is because just they are not prone to get that? So therefore, there are some issues, but still we need to practice these things. Now, in conclusion, what I want to say is technology-driven possibilities are rapidly growing and increasingly becoming available. The question is not which technology to be used, but what clinicians and patients need. Always I emphasize on the research question or the problem faced by our care providers or care seekers, not on the solutions or the technology. So the take-home message is very simple: focus on needs, problems, not on technology. Consider technology as a tool, not as a solution. Focus on preventive and early detection. Technology should be used to empower and engage patients. So I think that is all from my side. Thank you so much.
Okay. Thank you, Prof. Sabir, for the incredible explanation. It is empower our information, especially about AI and digital health itself, for the better future of the health system. Well, ladies and gentlemen, if you already have a question for Prof. Sabir, hold on for a second and please write it down first, because we will move to another session sharing. For this time is from Dr. Pitsanuro Kantawi from Maifahluang University. Before we start our sharing session today, I would like to introduce our wonderful speaker today, Dr. Pitsanuro Kantawi. Dr. Nuh is expertise in the field of the public health science and medicines, behavior and social culture, community participant and healthcare system, HIV and AIDS, healthcare for aging, quality of life, healthcare system for aging, primary health among non-communicable disease, qualitative study on zoonotic disease and human and animal interfaith and cross-border health programs and health system, transboundary. He also a lecturer in the Maifahluang University, Thailand. He finished his PhD program on public health in Chulalongkorn University, Thailand, and received Good PhD Dissertation Award College of the Public Health Science from Chulalongkorn University. With strong academic background and extensive experience in the health technology implementation, he has been at the front of the initiative at the harness innovative solution to improve health outcomes. His research to improve health outcomes. His research focuses into healthcare practices, emphasizing the importance of preventive care and health promotions. And also, he work not only addresses current challenges in the health system, but also explore the future pathways for the public health related. And today, he will present about the lesson learned from COVID-19. How did the pandemic affect health system? So, ladies and gentlemen, please join me in welcoming Dr. Pitsanuro Kantawi. Please give him applause. Good morning, Dr. Nuh. Are you ready to have sharing session with us?
Okay, I will share that you see my screen.
Session with us?
Okay, I will share that you see my screen.
Yes, it's already shown. Thank you.
Yes, okay. Thank you. We'll be started from the lesson learned from the COVID-19. How did the pandemic affect the health system? This one, if we have to review, this one is COVID-19 pandemic situation in Thailand. From this review, this one is COVID-19 pandemic situation in Thailand. From this one, if the Thailand, this one is several the wave from the COVID-19 outbreak occurred within not only Thai, April 2022. This one is the average number of the new laboratory confirmed COVID-19 cases reported, the decreasing by the 19% in the past 7 days. This one they are compared with the previous week. The total passing on 4 million reported cases of the COVID-19 in Thailand. This one is the death increases by the 20% with an average on 124 daily deaths reported in the past of the week compared with the one to the 100 of the previous week. This one, if the continued in steadily and increasingly on the rest of the death and occur since January in 2022. This one is COVID-19 vaccination program has been implemented efficiently on accordance with the Ministry of Public Health strategy and update. The plan in vaccinations included the migrant Thai and migrant in since February in 2021. This one is there are several announcements from the government, but the central level in the provincial level and requesting action to local authorities to work with the immigrations and community and in specific area control about the outbreak also. This one did show that the cumulative of the cases of the death by the nationality. This one you can see that on the mostly 85% of the Thai populations and the 3% of the Myanmar populations also, and include that on in the Cambodian and Laos also in the Thailand. This one is come from the WHO reported of this from the COVID-19 in Thailand on the health system. Due to the COVID-19 pandemic on the Thai health system and has insignificantly adapted established prevention, control, and treatment measure. There have been updates to the reimbursement system, procurement process, and supply vaccination, medicine, and medical equipment, as well as improvement to the patient care system inside and outside hospital. This the transformative please hospital at all the level and modifying their facility and to suit their situation, implementation a system and separate the general patient from the COVID-19 patient and expanded area to specific and critically to the view in the critically ill COVID-19 patients. Hotel were converted to fill on hospitality and quarantine center and out of the hospital medical services system as near on the home isolations established allow the patient recover at the home also that's one. Patients to the access medical and treatment. The foster problem-solving medical mechanism and better management ensure adequate medical equipment reach and service unit. However, they are despite the foster reimbursement process delay, remain and payment on the home isolations and COVID-19 patients requirement treatment in private hospital due to the issue. This one is incompatible database on system. This the severe of the COVID-19 pandemic of the highlight and effectiveness of the public health facility rural area and managing in the separate of the virus office. However, there have been some the focusing on the Bangkok and health center. They are much severe, the largest population in those in the rural area also. Additionally, Bangkok Hospital for the under the multiple administrative adjustment, making emergency management more the complications. In contrast, primary care healthcare system in the rural area, especially in Thailand, they have the sub-district health promoting hospital, village health volunteer. They has the reach and community more the effectively and provide the mutual support. Therefore, Bangkok should consider enhancing the role in public health volunteer function similarly on village health volunteer in the rural area by developing their knowledge based on increasingly by their using information technology system. From the hospital under the Ministry of Public Health and the other organizations such as Ministry of Defense and Bangkok Metropolitans, they have coordinated view during their crisis, regularly meeting among the executive to be shared and jointly use resources, integrating their work effectively during the emergency. During COVID-19 approval process and medical and vaccine in Thailand was relatively slow and partly and pharmaceutical and companies and not register their product. And we had expedited the approval relevant agency need to improve the drug legislation. And in the additionally in Thailand, we have 2015 Communicable Disease Act. This one did not provide sufficient authority management emergency situation leading to the governments and enacts on the emergency decree to the control the pandemic on the national level also. From the research study in the early impact of the COVID-19 outbreak, they found that the nationwide hospital survey, that's what is 98% hospital regarding where in the outbreak area has the preparations in the place of the handle of the pandemic. The top of three significant impact identified were facility management. The second this one is management of medication and medical supply and equipment. The third thing, this one is personnel management. Additionally, on the hospital, most commonly and introduced service and respond their first wave on the COVID-19 were ARI and clinics, and we have the COVID isolation ward and PUI ward also. The crisis management require out-of-the-box thinking on organization patient care, such as setting up the field hospital, developing a new innovation for the patient care, and integrating technology, enhancing services, accessibility like home isolation and community isolation also. And this one is the project in the past of the COVID or the health system expand under the universal health coverage will increasingly by approximately 0.7% due to the outpatient care about the 0.22% due to inpatient care. Rest attribute to the COVID-19 factor. Social media proof this one to be the valuable tool from the monitoring and situation and fostering and adaptations from the learning such as lifestyle adjustment developed to the new normal. Ongoing development and expansion and system and encourage from the integrating management system and localized situation, especially in Bangkok. They are supporting resource allocation management by the across region and enhancing information system and financial mechanism and budget response on emergency also. However, this one we have to recall frame the related migration and migrants during and COVID-19 outbreak. This one is might be the related cover of the people in the community in the country also. Immigration and border related law and the regulation. The second one thing, labor and related the law or regulations also. And the third thing, this one is public health law and regulations. From the immigration at the border related the law regulations also. We use the extensions of the Thai, the permanent resident visa on arrival and long-term visa they use from in the temporary boarding pass during the COVID-19 and regularly issue under the section 9 of the emergency decree on the public health organization in emergency situation. And this one we have to entry scheme into the Thailand through the test and go devices and measure and effective on the 2022. That's why they are sure that they require a documented if you are entrance into the Thailand also during that time also. From the label related the law or the regulation. This one is they might be focusing on sessions on the acts in 1977 and the Thai Labor Protection on Acts in 1998. This one is focusing on the labor who are working and alliance working and in 2008 also. This one is for general working and management emergency decree. This one is maybe to use from the 14 and working and management emergency decree also. This one they are supporting from the migrants and the foreigner working in Thailand also. The announcement of the Thai Ministry of the Labor regarding the permissions from the alliance to work in the kingdom and especially and we have according to the cabinet resolution in August 2021 under the epidemic resolution there are coronavirus disease in 2019 also. The government has determined prevention measure for the traveler entering in the kingdom that they affected the ability the migrant worker with the employee in the country ultimates from the labor short-term problem also. From the public health law, this one we have to many more from the health and law and needing support from this. From the public health measure response of the COVID-19 among the people in Thailand. This one they are focusing on the 5 areas also. Firstly, this one is risk communication and community engagement. The second one, this one public health prevention measure including personal protection equipment. From the third one is COVID-19 testing, and we have to treatment costs from the COVID-19 and vaccination also. From the leaks communication, they are providing in the community engagement. This one they are have to some the review, some the literature review, and some we have to some the research and event-based situations also. This one they are focusing on in the Thai population. They are easily and access to are covered. However, this one they are limited and difficulty and barrier from the focusing on the migrant population. Then so they are needed from the other NGO to support from the to the leaks communication also. Such as from the example, that's what they are launched from the some campaigns and some diseases. This one is might be to prevention and control, and we have to some the IEC material from the migration, include that Myanmar, Cambodia, and Laos also. And this one we have to some the evidence. This one we have to need the collaboration with the non-government organization and their expertise translation from the migrant language. This one is the critical components of communication regarding diseases, screening and prevention, and evidence in the intervention regarding communication among the government and NGO and relevant of the stakeholder also. This one, if we have to sum the challenges, the risk communication occur in the hard to reach migrant population who are undocumented migrant, and to read them. The officer, that's one approach from the two hospital base and border immigration officer. The concern, the key informant was monitoring and evaluation the risks to the risk commission due to the lack of the central guidelines and term of the vaccination allocated with the management, especially among the migrant population also. That's one if we have to need it from the service hotline to providing information from the migrant difference on the language, and hotline service that are cover prevention and self-testing COVID-19 with in the target populations also. From the public health prevention measure, including the personal protection equipment, this one we have to provide supporting from in the due to on the phase of the epidemic, thus as the Thai government have been forced urgently explore the new external sources, domestic manufacturing alternative, and safe way to reduce the PPE also. This one is what insufficient medical supply among the migrant and high risk area, especially migrant who not to work in the factory. However, local or non-government and CSO, this one is migrant health volunteer supporting medical supply in the migrants, the target population. Non-pharmaceutical interventions were implemented due to the outbreak situation, including personal prevention, epidemiological control, such as physical distance, travel bans, wearing face mask. This one is the factor related. We have to raise from the cover the PPE and migrant population was a status in the migrant. Because of those migrants, this one is who works and factory, this one provide the complete PPE and face masks also. This one, there's several revised results to show that the financial support and allocated of the PE and DTK assessing through the undocumented from the migrant are required also. From the COVID-19 assessing, this one in the migrant population, this one is a mandatory government on the COVID-19 testing as announcement in 2020, and announcement this has for the command item related migrant COVID-19 vaccination, which are all employer documented migrant have to perform etiquette testing and require from the provider, health officer, and committee leaders conduct the active case finding in village and community for the etiquette testing and distribution for COVID-19 vaccination to undocumented migrant. And before the hiring the migrant worker, this one all business must be conduct etiquette testing and COVID-19 vaccination. And all migrant must be have to etiquette and COVID-19 vaccination before the renting the house also. From the treatment, this one is high exponential number of the COVID-19 infected cases in the resulting in the hospital base and facility were in high demand, especially in Bangkok. There were the new coronavirus cluster was detected. The Thai government has made the solid communicate components as one to the supporting emergency COVID patient in the hospital national, and we have the precision hospital charted or the COVID-19 patient. This one they have to be implemented by the National Health Security. This one is may be to support by included any more from the charted for not charted to the COVID-19 patient for any health services also. This one if they have to the some the if there are the patient we have to admit and we have to testing. This one is support the National Health Security also. From the vaccination, the criteria of vaccination allocated the vaccination amount limited from the allocation and each area based on the high number of the migrant. The provincial health officer, they are core part of vaccination allocated and management from the especially in the provincial such as Phuket. This one is might be to cover on the migrant workers also. We are recommendation. This one is the vaccination and active case finding. This one measure. These are the key reducing on the number of the COVID-19 on the in the that's some the area, and the policy should be included from the migrant vaccination scheme, identify migrant as a priority. The vaccination maximize on public health and economic benefit. The immigration and border management measure, this one we are uses from the some the criteria, and we have to some set from the some the measure. This one if might be to enhancing timely surveillance, real-time evaluation, and the impact the cross-border mobility, and identify from the some the trigger and emergency the new wave and remain of this. We have to the recommendation. We have to the some the improvement data collection and surveillance. This from they have to the normal populations also. From the interagency, this one is coordinating. This one included from the border coordination, integrated coordinated border management and public health management into different area and context, and immigrations and trade facility and watch and PPE supply chain knowledge in the practice also. This one is might be to have to the some needed from the they are the concern about the lack of the supporting mechanism, and especially the budget and human resources to deal with the situation. The improvement should be to certain plan from the sufficient staff working at the border area, and we have to training the courses, facility and support the performance staff. And we have the strategy training should be to focusing on the capacity building and training the strategy in thinkings also. From the public health management different area, this they are focusing on included some the many more from the government sector, and there's some through the private sector. We have to some to work together. This one they are focusing on they are needing to some the government support to the target population and risk population also included from the marginalized population. This one is a vulnerable group. This one is need you to support from the implementation and some the provide some the area base. Also, we have to solve some the this problem. From the immigration and trade facility, this one is might be we have to some the set the some the criteria and standard operational specific from the COVID-19 pandemic and criteria. This one in level in east and the checkpoint. This one is might be the some use. This one is national guideline also. From the immigration trade facility, this one is we have to training staff. This one from the non-health will be to get involved, and we have to might be from the control, and we have to some the screening, some the we have to urgenting and reports and information sharing to the governments on the public health sector also. And this one if they have to the monitoring from the border immigration during the COVID-19 pandemic has become to issue to term undocumented migrant coming across the border without the health screening. This result is in missing immigration. That's what affect surveillance data. However, the local health authority has set up training in some provincial area on the situation, awareness training to the border immigration staff also. That's one if we have to mention on the some the PPE supply chain knowledge and practice. We have to some the mention on to some the provide some the factor from the immigrants, the factor of COVID-19 transmission such as poor housings, comorbidities, and poor practice and watch and COVID-19 positions, and we have to work significant high, especially among the migrant labor. The lockdown have the push from the study show that from the migrant population in Thailand has high level awareness and public measure and preventive practice. All measure including the mask wearing and hand washing and social distancing can be increased protection against COVID-19 in public setting also. From the recommendation, the practice on the resource and capacity building, training staff both in health and non-health. This one on the nature of the diseases and disease control measurements, management, and effectively and communication strategy within the public as specific in the standard operational procedure and training can be result onto in the establishment of the network in the collaboration between the internal, external business and officer also. From the IHR guideline should be shared to the educated to not only the health staff, but to share the element of the point of entry staff such as immigration officers, custom officer, and other raise awareness and willingness collaborated to the promote and best practice, the pandemic relevant prevention and control. From the community village health volunteer, they are an community-based organization and civil society organization, local and international collaboration together. This one might be to consider to compensation migrant and health volunteer who are provide service and irregular migrant because of they are the frequently required to take a time from their regulation, the job and their employer. That's when they are not paid from their daily wage also. However, this one if might be to continue collaboration within the other organization. This one is might be they are strengthening in the community and we have to the prevention and control of the diseases included on in the local level and we have to village health volunteer also. The risk communication, this one if might be to consider providing for information related on COVID-19 and prevention and control practice and different language, add more channel of communication, especially among the migrants, such as use Facebook, the other social media platform, reach them directly, and alternatively interpersonal communication should be planted to the local or community-based organization, civil society organization, who will have the staff who are able to communicate, meet face-to-face with the migrant also. This one if might be to have to clear and consistent public message should be to produce, especially on the personal protective recommendation also. This one's all my presentation. Thank you for your questions.
Okay, thank you very much for Dr. Nook for the interesting insight that have been given to us in this session related to enhance healthcare system after pandemic COVID-19. Well, ladies and gentlemen, now it's time for our discussion session. We will allow the participant to ask the question. For the participant who wants to ask the question, please raise your hand. And after we allow it, you can ask your question directly. Or for online participant, you can also ask questions through the chat box on Zoom. But before asking, please state your identity first. Okay, all right. Is there any question? Yeah, this is please for the committee.
Okay, thank you for the time. My name is Pandu. I'm a student from medical. Mr. Professor Sabir. Okay, Prof, in your opinion, what are the key challenges in health for promotive and preventive public health initiative in Taiwan public health outcome? Thank you.
It's a really interesting question. Okay, Professor, there is a question from the offline participant who are the AI and the digital health system in Taiwan, especially. Please.
Good. Thank you so much. Yeah, indeed, it's a good question, but you need to understand the infrastructure of Taiwan. Really, the health information systems in Taiwan are so advanced for the simple reason because they have adapted. It's not like now they are changing from paper to electronic. This will change the scenario because here each and every provider has to collect data and apply for each and every hospital, even all clinic needs to have electronic health record. Why I am saying this? Because once you have digital data will be the basic of any AI. So if you have enough data, again, getting back to the real problem, what you want to solve. This is one thing that is not challenged anymore in Taiwan. In my talk, it's not like you make a good model and you can go and implement that model in clinical practice. No, it's not going to happen like that. It has to go regulations, permissions, FDA approvals. Only then you can get into clinical practice or hospitals promoting this spin-off. What does it mean? If you have good model, you have good this thing plan, then you can start spinning off a company. Then you get approvals, you get all those things what I told. Then only you can get back to hospitals. And this is challenges, but what is good thing happening is FDA is getting into this thing. How to devices, SAMD. So now they are expediting. Now they know how to deal with this, because people they were used to see that software is there, totally new thing, but they are working so hard to get into. Are happening at very slow pace, but happening. That's all my answer to you.
Okay, for the participant, this is answer your question. Okay, thank you, Prof. Sabir, for the question. Probably I will check for the online participant first. Is there any question yet? Okay, not yet. Participant. Please, for the committee, help giving the microphone.
I'm Francisca Probo from Doctoral Public Health. From general medicine into personal medicine and prediction to prevention, I think this is a good idea for our future health. We know personalized need sequencing genome or DNA human patient. Like my cancer patient has medicine like trastuzumab, but right now trastuzumab is not cure someone who has mamai cancer. So personalized question, how to voice or promoting personalized medicine to the community that we know they still of asking AI. And then what is the examination flow to achieve
Thank you. It's very
Thank you.
practical question what you are asking. Okay, one way of doing personalized medicine is your question is, although it is becoming cheaper, but it is not available for everyone in the rural areas. There is still some issues. I totally agree with that. On other side, you don't need to depend only on genomic information. You can also depend upon these comorbidities, the medication lab values, what type of medicines will be really working, knowing the allergies and all those stuff. So in that way, we can go promote. I want to come back to my same point of engagement and empowerment. Like you told, people go and try to find something on internet, and the problem with this internet is whatever they see, they think it is accurate, it is correct, which is wrong. There is law. Therefore, we need to know how to educate people, how to distinguish between trustworthy and false information. We need to teach them to know the source of the information, purpose, motivation of the information. So in this way, we try to avoid some medicines or diseases in our common population. Thank you.
Okay, for the participant who asking the question, is this answer your question? Because from the chat box from Zoom still empty. I think I want to ask to Dr. Nook. Yes, because it was interesting topic. I think about life after pandemic, right? So and also law and etc. that you already explained. How the impact on the workload in the healthcare professional, especially in Thailand, after policies. Thank you.
Okay, thank you so much for your questions. This one is many more high impact from the it might be the workload. However, this one is from the Thailand they are launched some the policy to have to some the set up some the another staff to make the some in each level, such as in the provincial level also. They are add up more some the public health staff to add up on the health facility also. This education. This one we have to some the community station include that some we have to meet up more from the it might be to link in the target population such as from in the vulnerable group in the Myanmar in the migrants population health volunteer. This one might be to linkage working together such as a body and health system and from the provide some basic health care in the people in the target population from in the public health staff in Thailand. However, this one more policy. They set up some preparedness planning and strategic. We have to do some the risk management also provide that we have to get involved from the non-health organization. We have to get involved from the preparedness plan and strategic from to have to the in the future pandemic. This one is might be to they are ready to prepare and solve from this problem in the future. That's one is my questions.
Okay, thank you for the answer, Doctor. It's already answered my question. For limitation of the time, I think that's enough for the discussion session, and that's bring us to the end of this session. Before I close this session, I would like to invite both Prof. Sabir and Dr. Nook for having closing statement. The time is yours.
Yeah, thank you. Thank you. I think I have already given my closing statement or take problem of the caregivers and care seekers, number one. And number two, technology is a tool, not a solution. So please focus on real problem, and focus on prediction, prevention, and early detection. So that
Okay.
is
Thank you,
my
Prof. Sabian. And now we would like to invite Dr. Nook for the closing statement. The time
Thank you
is
so
yours.
much. From my point, this one, if we have to the key points, keyword together, this one we have to work in the future preparedness, and we have to do some the pandemic. You have management also in the future on the plan, strategic plan, and we have to in the finally this one we have to some the get up to public health part. This one is maybe not non-public health, also non-health, also we have to get involved. However, this one is maybe we have to some the set up the volunteer to support and prevention and control in the future on the community level. This one is might be strengthening from the prevention and control diseases in the future. Thank you.
Okay, thank you, Doctor, for the closing statement. Okay, well, ladies and gentlemen, please give an applause presentation, and thank you for all the participants who are following valuable discussion. Hopefully, this meeting will be beneficial for everyone, and I apologize as a moderator. I'm also apologize if there is some technical problem happens during this session. Thank you very much for your attention, and I hope you all in this room will stay healthy. I will return the event to the MC. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you so much for Ms. Adisa Aulia Savitri and Clean Farm, and all the invited. You have something good to bring back home. Ladies and gentlemen, this is the end of the first and second plenary session, and we would like to inform you that we will have for around 45 minutes until the main room to hear the keynote speech from Professor Ali Gufron. Para peserta dapat menikmati makan siang yang telah disiapkan di restoran yang tersedia di depan, dan dengan durasi 45 menit sampai pukul 1.15. Dan di 1.15 karena akan mendengarkan keynote speech dari Profesor Ali Gufron. Terima kasih.